Good afternoon to all of you. Today the debate is, can good glycemic control prevent brain damage? I will speak against the motion. So first should be the, I think first should be the Arundhati who would speak for the side. You can see Sunil Gavaskar on right hand side. Greatest batsman. From see, you can see the differences from present.
I think you'll have to present my talk first, my debate, because I'm for the motion and Dr.
Arundhati. Hi, Arundhati. So, Alex, even kindly present Dr. Arundhati's talk first, because she will be for the motion.
The debate has already started. Which first?
Debate has already started. Rightly interrupted.
Here we concur. Here we agree.
So which one first?
For the motion, Dr. Arundhati would be speaking for the motion.
Yeah.
Start Arundhati's presentation, Stuti.
So, good afternoon. I think this is our recording being done for the debate. And my topic that has been assigned is, can good glycemic control prevent brain damage? And I'll be speaking for the motion. So when we talk about the glycemic control and brain damage, there are three questions that need to be answered. Number one, what is the connection between glucose levels in the blood and the brain? Number two, what is the connection between poor glycemic status and the brain? And number three, if there is a connection and it is an inadvertent connection, then does correction of the glycemic status prevent brain damage? So these are the three questions that we need to answer before, talking about does good glycemic control prevent brain damage. The 12th of January, that is yesterday, was celebrated as the birthday of a great philosopher, Swami Vivekananda, and he has told us that the greatest truths are those which are the simplest things in the world. And talking about one of the simplest things in our body, the glucose level and the brain connection. So we know that the human brain represents only 2% of the body weight, but it utilizes almost 1/5 of the total body glucose. I think I can just tell you this sentence and that will be enough to tell us about how important glucose is to the brain. And when we talk about that, when we look at how important it is, not only in terms of the primary source of energy, which it is, definitely it is, because it's taking away that amount of blood glucose and utilizing it for that bit of the body weight composition. But apart from the source of energy, it is also a source, it is also very important in terms of certain regulatory functions. Like, for example, it acts as a substrate for the precursors of neurotransmitters, maintenance of the ionic concentration gradient across. So thereby, it is inevitable that something which is taken up in that amount, which is so important, any kind of dysregulation in the metabolism of that particular molecule will lead to disruption in the functioning of the brain. And thereby, we do see a lot of dysregulation in the brain functions, cognitive impairment, and loss of critical brain functions with the alteration of blood glucose levels. Just to understand, that the glucose is just not merely taken up and, just utilized for energy. You can see these are the various areas where it is acting, specialized centers in the brain, the POMC, the AGARP neurons in the hypothalamus, that is A. B, which is telling us about the neurovascular coupling as the glucose is supplied to the brain, which is metabolism dependent. C, which is telling us about the other metabolites along with glucose being rapidly distributed through a highly coupled metabolic network. D, which is telling us about how it acts as a source of energy for the neurotransmission. And lastly, when we're talking about the other glucose metabolism enzymes, which are important in terms of controlling cellular survival. What is the connection between hyperglycemia and the brain? Swami Vivekananda has told us that anything that makes you weak physically, intellectually, and spiritually has to be rejected as poison. Hyperglycemia is one of that for the brain. Look at this study, which has told us about how the central nervous system is a conductor, which is orchestrating all the metabolic regulations by both hyperglycemia and hypoglycemia. In short, poor glycemic control. When we're talking about brain disruption, we're talking about stroke, number one. Number two, we're also talking about the cognitive dysfunctions and even dementia that can result from alteration in the glycemic status. This is a picture telling us about the functional disabilities that occur when hypo and hyper metabolism of glycemic levels occur at the peripheral level. This is what occurs centrally in the brain. We have seen several studies telling us about, this is one study. Why I have projected this is because we did see that the glucose crosses through the blood-brain barrier. Now, what has been seen in acute as well as chronic hyperglycemia is an alteration in the local cerebral glucose utilization. And what that results in is something we will discuss subsequently. So this capacity to transport glucose is altered during chronic hyperglycemia, and that leads to several disruptions, downstream. This is again telling us about the association between long-term hyperglycemia and insulin resistance with brain atrophy and cognitive decline. We will go ahead and these are other studies telling us about the risks of cognitive impairment and dementia. This is 144 prospective studies. We do know this today for sure that diabetes is related to various kinds of dementia, vascular dementia, as well as Alzheimer's disease. This is again a study which is telling us about the association between late life diabetes status and hyperglycemia with cognitive impairment. This is the Mexican Health and Aging study telling us likewise about the association between HbA1c of more than 8 and worse cognitive performance. The sex-specific association also looked into this and found definite the role of hyper and hypoglycemia in the trend towards Alzheimer's disease and vascular dementia. When we look at pictures from type 1 diabetes, also assessment in terms of the dementia scale, the MMSE, the dementia assessment sheet, all of them faring worse in case of poorer glycemic control. If we look at the spatial patterns of the structural brain changes in type 2 diabetes, we do see alteration in the gray matter volumes and better control translating into a lesser loss of gray matter volume, again telling us about the importance of maintaining good glycemic control to prevent these damages across. This is a study telling us about the association of pre-stroke glycemic control with the vascular events during a 1-year follow-up, again emphasizing the detrimental role of hyperglycemia in terms of stroke outcome. Similar study, this is a meta-analysis again telling us about the relationship between the altered glycated hemoglobin, higher glycated hemoglobin resulting in a worse stroke risk. And post-stroke recovery also, it has been seen that glycemic control, this is a meta-analysis of 29 studies, and it did say that of these 22 studies told us that diabetes had a negative effect on the recovery of a person after stroke. Persistent post-stroke hyperglycemia, independent association with the infarct expansion and worse clinical outcome. This is again similar study telling us about the treatment of hyperglycemia having beneficial results in terms of ischemic stroke. This is a randomized pilot trial. If you look at the potential mechanisms, there are various pathways which can explain this association, across the inflammatory pathways, the PKC, the AGE, the ENOS, the TGF. Cannot go into the details, just showing you the pictures which show the association across the various pathways between diabetes, hyperglycemia, and diabetic dementia, about the relation with autophagy, the relation with cognitive impairment, about the alteration in the blood-brain barrier that we were talking about, which compromises the blood-brain barrier leading to memory loss in both type 1 and type 2 diabetes. Again, disruption of blood-brain barrier producing various protein secretion on the extracellular microvesicles, again leading to worse cognitive impairment. This is a study which looked at the white matter hyperintensity progression. This is the accordion mind study, again showing us the very, very strong role of hyperglycemia in terms of the changes in the white matter as well. These are the associations with the diabetic stroke and the Alzheimer's disease. Unfortunately, I cannot go into the details of all this, but so many studies, thousands of studies have been done which have told us about the very important role of glycemic status on the brain functioning in terms of vascular functioning, in terms of the cognitive and memory and other spatial functionings as well. Does good glycemic control have its benefits? Now, very importantly, as Swami Vivekananda has told us, that words may lie, but actions will always speak the truth. These are some of the studies that have shown us the reversibility of brain glucose kinetics in type 2 diabetes. This is the cerebral glucose transport capacity that is altered. This is the meta-analysis of 16,000 patients telling us about that intensive glucose control can slow cognitive decline. This is again a study telling us about better inpatient diabetic control, giving us better results in terms of cognitive impairment. This is a systemic review, 13 studies telling us in terms of all these benefits. You can see the benefit favoring the glycemic control. These are also other studies showing us about how glycemic control had a significant effect on cognitive impairment. All the other parameters of cognitive impairment also led to definite shift towards the right, which is favoring glycemic control, intensive glycemic control. These are the pictures from type 1 diabetes, again, effect of glycemic control on cognitive function. These are the intellectual quotient, verbal intellectual quotient, memory, attention. We're looking at the digit symbol substitution, all cognitive functions, definitely all of them telling us that good glycemic control do give good results in type 1 and type 2 diabetic patients, both. This is talking about the improved, better working memory in patients with type 2 diabetes. This is the last study that I'm going to quote, a study which looked at the closed loop insulin delivery system and tried to look at the neurodevelopmental and cognitive outcome in type 1 diabetes. These are the differences seen in the cortical gray matter, white brain gray matter resolution, the group differences in brain structure over time, and the indexes, the perceptual reasoning index, the verbal comprehension index, and the full scale IQ. All in all, telling us that those who were better controlled had definite benefit in terms of neurotypical development during the adolescence. The hybrid closed loop telling us better, giving us better results with the reasoning index, with better glycemic control, of course, and telling us that the alterations in the developing brain in type 1 diabetes might be preventable or reversible with rigorous glucose control. This is a very important statement, so that we at least we definitely agree that there is a strong connection between blood glucose levels and brain functioning, strong connection between poor glycemic status and brain dysfunction, and correction of glycemic status. As I have shown in some of the studies, we can go on and on about the number of studies that have done and shown results to the benefit, so that improvement in glycemic status does prevent brain damage. And lastly, as Swami Vivekananda has said, speaking today of the 12, that tell the truth boldly, and so be it said, that good glycemic control can and definitely does prevent brain damage. I rest my case here.
So thank you. That was a wonderful talk. So we'll play the next thing by Dr. J.B. Kanwar. So over to RX Events, and then we'll have 1 minute of rebuttal from each side.
A very good afternoon to all of you. Today the debate is, can good glycemic control prevent brain damage? I will speak against the motion. And to start with, you can all recognize two greatest batsmen you have seen in your life. On left-hand side, you can see Sunil Gavaskar. On right-hand side, this is Vivian Richards, two greatest batsmen. And just to see, you can see the differences from present time batsmen, that they are not wearing helmet. And they used to say that you use your mind to protect your brain instead of helmet. But my opponent, she uses the helmet of hyperglycemia to protect the brain. So I do accept what Dr. Arundhati said. I do accept that in diabetes, that there is higher risk of dementia, particularly vascular and Alzheimer's etiology of about 2 to 3 times higher in diabetes population. But the question is, today the debate is about whether the normal blood sugar can protect. We do understand that hyperglycemia can cause cognitive decline. So if there is increased blood sugar, that is whether that is related to cognitive decline, then if you achieve the normal blood sugar, that would reduce or prevent cognitive decline. So today's question is, does normal blood sugar level can prevent or at least reduce the cognitive decline? So we are not debating that hyperglycemia causing cognitive decline, dementia, Alzheimer's disease. I am not against that. I am saying even if you achieve the normal blood sugar, you are not going to prevent that or reduce cognitive decline. The data comes from the Accord Mind study. Dr. Arundhati has already spoken about that. This is a study of the Accord. As you know, there were 10,000 patients who are in the Accord study, and the aim of this Accord Mind study to whether the restoration of normal blood sugar level in type 2 diabetes can influence the cognitive performance. There were about 3,000 odd patients in Accord Mind study, in about 1,400 in each arm. And they looked these patients at 20 months and 40 months for digital substitution tests, which Arundhati has already spoken about this importance of this score. And the result of this study is there is no significant improvement at 40 months in either of the groups. There is no improvement in the cognitive if you intensively treat or you have a standard mode of treatment. So that's to give the idea that the intensive blood sugar control is not protective. So could this be because of the intensive control? It could not have the primary outcome of decreasing cognitive decline. So could this be because of the hypoglycemia? However, in Accord Mind study, those patients who had a history of severe hypoglycemia, they are excluded from this study. So the take-home message from ECORMIND study is that intensive blood glucose lowering should not be undertaken to delay cognitive impairment in elderly patients with long-standing type 2 diabetes. So even if you achieve normal blood sugar, that should not be done to delay the cognitive decline in type 2 diabetes. What are the factors which is related to cognitive decline, whether this is increased blood sugar level or insulin resistance? To find out the answer, this was the study, this is a prospective study from 2 studies, Prosper study and Rotterdam study. They looked into the in the non-diabetic population. If you in the different quantiles of the fasting blood sugar level, you can see in X-ray in X-axis different quantiles of fasting blood sugar level and different parameters of cognitive decline. They looked at it. They didn't find, even after the follow-up of 5 years, there is no significant improvement in cognitive function, whatever the fasting blood sugar level may be higher, may be lower. There is no improvement in the cognitive from this Prosper and Rotterdam study. The conclusion for this Prosper and Rotterdam study is that elevated fasting blood sugar level and insulin resistance has not associated with worse cognitive function in older people without history of diabetes, and they also compared to diabetes, there is no significant difference. And we also know from the DCCT and EDIC trial, from the type 1 diabetes patient, if you look at this X-ray, the panel on the right-hand panel, you can see they looked into the 8 domain. In type 1 diabetes, the follow-up type 1 diabetes patient in EDIC study, there was no significant change even after the 18 years follow-up type 1 diabetes. There is no change in the whatever the HbA1c level. You can see HbA1c level less than 7.4% or HbA1c 7.4 to 8% or more than 8%. In any of the domain, there was no significant change even after 18 years of follow-up of these type 1 diabetes patients. Neither frequency of severe hypoglycemia nor previous treatment group associated with decline in any cognitive domain. That was the result of DCCT and EDIC follow-up study. And if you look at the increased risk of stroke, as Dr. Arundhati was saying, that hypoglycemia causes increased risk of stroke. This is a study which looked into the HbA1c and increased risk of stroke. They looked about 70,000 or type 2 diabetes patient, and when they looked into the incidence of stroke, they found out that the U-shaped relationship between the HbA1c and stroke level. If there is HbA1c is low or HbA1c is high, there is high risk of incident stroke. That means even if you have normal blood sugar level, there is increased risk of stroke in patient with type 2 diabetes. UKPDS study, HbA1c well controlled. You can see on the first panel, you can myocardial infarction, newly diagnosed angina. These are all decreased with the lowering the HbA1c level. But on the right-hand side, you can see the fatal, non-fatal stroke, whether the HbA1c is less than 6.3 or 6.3 to 7.6 or more than 7.6, the hazard ratio remains 1. There is no significant improvement even if you achieve the target HbA1c of less than 6.3. And looking at that, European Stroke Organization, they also recommend that we should not achieve the normal tight glycemic control to improve functional outcome in ischemic stroke as well as hemorrhagic stroke. But the quality of evidence may be low, but the guideline says that you should not have a normal blood sugar to reduce the risk of stroke, both ischemic and stroke. Now, what will protect the neuroprotection? If it is not glucose, then what can protect the glucose? You can see from this picture of the famous strike by Mr. Arvind Kejriwal, which was for 14-day fasting, and the fasting was broken by Anupam Kher, and in spite of 14 days of fasting, didn't have any problem. This because we know that ketones are the alternative source of energy during nutrient deprivation, and the role of ketone body is reviewed in several anti-inflammatory cellular pathways, improving glucose metabolism, insulin action, and synaptic classes are all been known. Just to end my statement that this is by Albert Cornus in 1842, he says, nobody realized that some people expend tremendous energy merely to be normal, merely to keep everything normal or normal blood sugar level. And all the answer comes from the Bhagavad Gita. Bhagavad Gita also says, Sri Krishna says to Arjuna that Asanyatatmata yoga dusprapya yati me mati Vasyatmanatu yatata sukyo bhaptu mupayata. That means Sri Krishna is saying to Arjuna, you control your mind with meditation to protect your breath. Thank you.